Happy Thursday. So today, one of the topics I'd like to bring up is something that's very important to me because it really helped my career in the early stages. It helped me learn the business a lot faster because of the trial and error. What I'm talking about is working with advanced practice providers. Now, they don't like to be called that. So working with nurse practitioners, physician assistants, the number of jobs and the needs for them is growing exponentially. Okay? It's getting harder and harder with the doctor shortage, especially since COVID. There's a whole lot of doctors that retired. It's a lot faster for nurse practitioners, physician assistants to get their degrees, to get their training certified, get working. And it's a great fill-in, right? Now for me, and this is just something I'd share, and maybe other recruiters out there can help them, especially if you're new to the healthcare staffing industry, especially when it comes to locum tenens. I spent my first 8 or 9 months in this industry working on nurse practitioners and physician assistants. And the reason why was because, one, the mass amount of jobs that we had with the company I was with, but also how quickly they credentialed, how quickly they went to work, and it allowed me to make mistakes, right? Because as a recruiter, your first year and a half, you're making mistakes, and you're going to make a whole lot of them. And you need to make those mistakes because you need to learn from them so you know what not to do in the future. So what I did is I learned to work with the nurse practitioners, physician assistants, and honestly, it was great because they would actually help educate me, right? Sometimes the doctors are a little busier and you know, they're not as prone to having those conversations with you. And so when I was learning the business, I worked with NPs and PAs and helped them, help find them assignments, but they also helped educate me on the industry. And so I was able to sort of make the mistakes without going after those bigger fish, right? Going after your surgeons and your anesthesiologists and, gastroenterologists and, cardiologists, just your bigger specialties, right? Because I didn't want to mess up. Because you really only get you got one first impression. That's it. So you got to make it count. But the important thing is the growth for nurse practitioners and physician assistants is constantly growing more and more. And your facility, it can benefit in a huge way if you just hire them for your short-term needs or bring them in during times that you need the coverage. If you're able to get away with it. Now, that's if your hospital has bylaws for it. It all depends on the system, right? The healthcare system you're working with. But bottom line, you have to work with NPs and PAs, okay? They will help in such a huge way at a much lower cost than what a physician will. And they'll still get the job done. So always keep that in mind. Always remember that if you can use an NP or a PA because you can't find a physician, you've been searching for a physician for 4 or 5 months, you can't find anyone, figure out if you can use a nurse practitioner or a physician assistant, at least in the interim, so that they can cover that gap until you're able to find the physician. So that's all I got for it. Hire more NPs and PAs. They're there to help. There's a heck of a lot more of them out there than there are physicians. And if you need the coverage, you know who to call. Nortec, come on.